So today we are going to start our pathology section. So today we are going to study congenital heart diseases. Congenital heart diseases are of two types, those known as cyanotic and those known as non-cyanotic. The ones that are cyanotic are basically due to right to left shunt, and those that are non-cyanotic are basically due to left to right shunt. So that's an important distinguishing factor that you need to remember. Right to left shunt causes early cyanosis, also known as blue babies. These are often diagnosed prenatally or become evident immediately after birth, since the baby is fully cyanosed. To remember the right to left shunts, you need to remember the 5 Ts. That is the truncus arteriosus, the transposition of great vessels, the tricuspid atresia, the tetralogy of Fallot, and the TAPVR. So the pattern truncus arteriosus or truncus arteriosus is a condition in which there is defective formation of the aortopulmonary septum, and since there is no aortopulmonary septum, the aorta and pulmonary artery are present within the same main blood vessel. Therefore, there is mixing of the oxygenated and deoxygenated blood, and the baby is born cyanosed. Then you have the transposition of blood vessels. Transposition of blood vessels is when the aorta arises from the right ventricle instead of the normal left ventricle, and pulmonary blood arises from the left ventricle instead of the normal right ventricle. This again causes mixing of the oxygenated and deoxygenated blood, and the baby is born cyanosed. It is also due to failure of aortopulmonary septum spiral, and therefore we get a monostrain appearance in chest X-ray, which is a characteristic finding of the transposition of blood vessels. Without surgical intervention, most infants die within the first few months of life. Then we have the tricuspid atresia. Tricuspid atresia is the absence of the tricuspid wall and hypoplastic right ventricle. Since there is no tricuspid wall, the blood cannot move from the right atrium into the right ventricle, and hence the right ventricle is hypoplastic. And in order to correct the tricuspid atresia, we need to make an atrial septal defect and ventricular septal defect through surgery for the fetus to be survivable. Then we have the tetralogy of Fallot. Tetralogy of Fallot is caused by anterosuperior displacement of the infundibulate septum. Tetralogy of Fallot is comprised of 4 abnormalities that are remembered in the mnemonic groove. The P represents the pulmonary infundibular stenosis, that is the pulmonary stenosis, and due to the pulmonary stenosis there is decreased emptying of the right ventricle. So the decreased right ventricle emptying causes right ventricular hypertrophy, which gives the appearance of boot-shaped heart on chest X-ray. Then we have the overriding of the aorta, and the last is the ventricular septal defect. Then we have the total anomalous pulmonary venous run, also known as TAPVR. So TAPVR is basically when the pulmonary veins drain into the right heart circulation instead of the left atrial circulation. So it is associated with ASD and sometimes patent truncus arteriosus to allow for right to left shunting and maintain the cardiac output. Then we have the Epstein anomaly. Epstein anomaly is the displacement of tricuspid wall leaflets downward into the right ventricle. So there is basically inversion of the tricuspid wall, which normally has to be in the right atrium, but they are displaced downward into the right ventricle. It is most likely due to lithium exposure in utero. It is also associated with tricuspid regurgitation and right-sided heart failure. Then we have the non-cyanotic or acyanotic congenital heart defects. These are due to left to right shunts. These are in frequency. VSD is the most common, then you have the ASD, and the least common is the PTA, also known as patent truncus arteriosus. So ventricular septal defect is asymptomatic at birth, but it may manifest weeks later, or it can remain asymptomatic throughout life. Then you have the atrial septal defect. Atrial septal defect is the defect in the interatrial septum. It produces the white fixed split S2 that we have studied in our physiology section. So the ostium secundum defects are the most common defects that we studied in our embryology section. Symptoms range from lung to heart failure. It is distinct from patent foramen ovale in that septa are missing tissue rather than unfused. So the oxygen saturation in the right atrium is more, and in the right ventricle it is also more, and the pulmonary artery it is also more. This may lead to The atrial septal defect may lead to paradoxical emboli, that is, a systemic venous emboli used ASD to bypass lungs and become systemic arterial emboli. So ASD and VSD both are associated with the Down syndrome. Then we have the patent ductus arteriosus. So during fetal life, this patent ductus arteriosus is important for the viability of the fetus since lungs are underdeveloped and the blood is bypassed from the lungs into the aorta through patent ductus arteriosus. However, after birth, if the ductus arteriosus is persistent, this condition causes fetal abnormality. It is associated with a continuous machine-like murmur. Patency is maintained by PGE synthesis, that is the prostaglandin synthesis, and low oxygen saturation. So uncorrected PDA can eventually result in blood cyanosis. So this cyanosis is known as the differential cyanosis, that is the upper extremities have normal blood supply, whereas the lower extremities have decreased blood supply. So this causes cyanosis in the lower limbs, and this type of cyanosis is known as the differential cyanosis. So PDA is normal in utero and it normally closes after birth. Eisenmenger syndrome is uncorrected left to right shunt, that is due to VSD, ASD, or PDA. So the increase in pulmonary blood flow eventually causes pathologic remodeling of the vasculature of the pulmonary system, and it results in pulmonary arterial hypertension, which eventually causes right ventricular hypertrophy. It can cause blood cyanosis, clubbing, and polycythemia. So age of onset varies depending on size and severity of initial left to right shunt, but Eisenmenger syndrome is a lethal condition and most of the babies die in Eisenmenger syndrome. Then you have the coarctation of the aorta. Coarctation of aorta is basically aortic narrowing near insertion of the ductus arteriosus. It is also known as juxtaductal aortic constriction. It is associated with bicuspid aortic hole and other heart defects. It is also commonly seen in Turner syndrome. So in this condition, there is hypertension in the upper extremities and weak delayed pulse in the lower extremities. This causes the brachiohemotherapy, a characteristic sign that is present in coarctation of aorta. With age, there is intercostal arteries enlargement due to collateral circulation, and these arteries can erode ribs, and this can give the notched appearance on chest X-ray. The complications of coarctation of aorta include heart failure, increased risk of cerebral hemorrhage, that is perianeurysms, aortic rupture, and possible endocarditis. Then we have the congenital cardiac defect summary. The prenatal alcohol exposure, also known as fecal alcohol syndrome, is associated with VSD, PTA, ASD, tetralogy of Fallot. The congenital rubella causes congenital rubella syndrome, which is associated with patent ductus arteriosus, pulmonary artery stenosis, septal defects, and it can also cause deafness and cataracts and microcephaly in children. Down syndrome causes AV septal defects, that is endocardial cushion defects such as VSD and ASD. So the infant of patient with diabetes during pregnancy can be born with transposition of blood vessels. Marfan syndrome is a connective tissue disorder. It can be associated with mitral valve prolapse. So prenatal lithium exposure can cause abstinence anomaly. Turner syndrome is associated with bicuspid aortic hole and coarctation of aorta. Williams syndrome is associated with supravalvular aortic stenosis, and 20q11 syndrome, also known as Dichiot syndrome, is associated with truncus arteriosus and tetralogy of Fallot.